Hey, everybody. Good morning, good afternoon, and welcome to our monthly mastermind meetings. For those of you that are new to our meetings, we get together once a month to provide education by industry experts to help you grow and scale your business. 1 hour every month that you can focus on a new idea and hear from your colleagues what they are doing to grow their business and increase their revenue. I encourage you to join our private Facebook group, which is reserved for owners of medical billing companies. You can post questions to the group and continue to keep that connection within the medical billing community. Please save the following dates for upcoming mastermind meetings. We have May 9th, we have Dave Giachello presenting on new business tools for running your business. June 13 and June 9th are the next mastermind dates. We're going to be talking over the next year about benchmarking, reporting, what to do to get to the next level, building, motivating, and rewarding a winning team, and new marketing ideas. So do you avoid bringing on new clients because you're worried you don't have the staff to service them? Are you competing on price with other billing companies and not bringing in enough clients? It may be time to consider offshoring. Data entry agents, coders that work at night, and AR agents that work during the daytime and are being managed by an entire management team. You could reduce your labor cost and increase your profitability. If you've thought about outsourcing but not sure how to get started, please reach out to me. I'm happy to help you. And if you're currently using an offshore vendor and feel disconnected from your team, a lack of communication and transparency, fluctuations in quality, let's talk and we can give you some ideas on how you can improve your relationship and get more from your offshore team. My name is Hani Gluck. I am the CEO and founder of 4D Global. We help medical billing companies grow and scale their business profitably by providing offshore resources in India. Our mastermind meetings are one of the many ways in which we help you grow your business. Okay, I'd like to introduce you to my good friend, Bob Burley. I was fortunate enough to see Bob in New Orleans in February at the NBC conference, and he gave me the private tour of the French Quarter with a few friends. Melissa, it's good to see you here too. Most of you already know Bob from the NBC conferences, formerly known as the Owners and Managers Conferences for HBMA. And for those of you who do not know Bob, it's all yours. Take it away.
Thanks, Hani. So I'm Bob Burley, and I have a consulting business, Brandywine Healthcare, here in Pennsylvania. And I've worked across the country and internationally in the billing industry since 1982. That was after 10 years in healthcare in the hospital side. So I've been providing education and training on benchmarking and a variety of related subjects. When Dave and I teach the Medical Billing Executive Conference that Hani mentioned, I'm the data guy. I'm the analyst, the number cruncher, and it's just part of my DNA. So when I look at billing companies, I used to own one. A lot of it has to do with employee productivity and finding the best way to do things. So when I talk to billing companies about, well, you do work here, and there was a little humor in the intro there, or the publicity. How many people work here? Well, on a good day, about half. Well, when I've talked to billing companies about how do you provide, how do you measure staffing? How do you measure work? And I often get the answer, well, we just have to get everything done, whatever that means. So what is everything? So how much work is there to do? Have you measured the work? Is it pounds? Is it, is it dollars? What is it? The unit of work in the medical billing business is a claim, which you can visualize as a 1500 form, which may have 1, 2, 3, 4, 5, 6 different CPT codes. So unit of work isn't a CPT code. A unit of work is the claim that has several of those. How much time does it take to do the many, many, many tasks that billing companies perform? And what is the most appropriate skill at the lowest possible cost? You don't pay a coder to do filing. And the CEO shouldn't be, sweeping the floor, except if you own the business, that's what you often have to do. So what's the lowest cost to do a good enough job? And can you keep up with the work? Because when I talk about this in hearings and court testimony as an expert witness, I tell people the river never stops. The one thing about our business is the flow of new work is absolutely constant. You can't call time out. So can you as a company, can our customers afford a backlog? And the answer is no. We've got to get everything done, whatever that means. So what's the best way to get a task done, and what's the worst way? And, you know, which is the most expensive way to do things, or the least expensive? So the mantra in business, not just in billing, is do it better, do it faster, do it cheaper, do more of it at the same cost. And for some reason, oh, there we go. Okay, so for example, in demographics, the best way to get demographic information is electronically. You should be getting it by download or transfer from your customer. And you should be getting that information within minutes of the service being performed, or at least within 24 hours. For those of you who do billing for hospital-based practices, emergency radiology, anesthesia, et cetera, getting a download once a day is actually more practical than getting it every time a new patient goes through. But you should be getting it quickly, not 4 days later, not a week later, not 2 weeks later. You should be controlling the information and have it reconciled to an original source, a departmental log. You know, if for those of you who are old enough to remember day sheets and pegboards, you had a register of who was seen that day. Are you tying what you got to an original source so that there were no patients lost where charges aren't going to be billed because you never knew about the patient? Do you have front-end edits to prevent mistakes so you can't put alpha characters in the zip code? And there is software that will actually make sense of social security numbers and so forth, so that you have front-end edits, even if somebody is doing the data entry, that they can't make mistakes that are preventable. And everything should be happening within 24 hours. The worst way to do it is to have your customer sending you stuff, the demographics, on paper. You get it days later. It may be in an envelope or a box. It may be incomplete. There's no reconciliation of how many patients there were versus how many pages are in the package. You're not reconciling it. You just do what you get, and you don't even know if you skipped a page that you skipped a page. You're posting things by manual entry without any productivity. For example, everybody has Brandex software. Well, you use what you use. How many seconds, with a stopwatch, how many seconds does it take to enter the average demographic? If you have to do it by hand, what's the benchmark? You know, some are longer, some are shorter, but there's an average. And if it should take you 97 seconds or 3 minutes and 12 seconds, and that's the measurement, then you can project how much work there will be, when a batch should be done, and so forth, and what to expect of an employee. If you give them 25 registrations and it takes them 6 hours, there's a problem. So getting it done eventually isn't really the way to run a business. You've got to be more efficient, and you have to know what to expect. The same with coding. So if you provide coding as a service, do you have direct access to the electronic medical record, or is it auto-downloaded so that all the records for the anesthesia department from yesterday are automatically marked and transferred to an FTP site or bundled in an encrypted file? If it's possible, the specialty may allow for the charts to be pre-read and codes offered, so that there are a number of packages that do that, several in radiology, for example. The software will suggest, that's my term, suggest a code. The coder then approves those codes. Why do that? Well, if a coder without any software support can code 100 charts an hour, but with all the codes identified and suggested, that same coder could process 300 charts an hour and pull out the exceptions where the software may not have made the best choice or it's not clear. You have now accelerated productivity, and you have to account for the cost of the software, but typically it should pay for itself. When a code is chosen by a coder, whichever way that occurs, it should automatically load into your billing software. It shouldn't require somebody with a keyboard to type that stuff in. And that should include modifiers and diagnosis codes. The software can have real-time CCI and payer edits, and all of this should be happening within 24 hours of arrival, preferably within the date of service, but within the date of, 24 hours from the day you get it. And if it's work from Friday, Saturday, Sunday, then it should be done by the end of the day, Monday. The worst way would be getting paper chart copies. Among other things, that's a HIPAA problem. Now you've got PHI on paper and it's radioactive. You've got to figure out how to move it around the office, how to keep it controlled, whether to, shred it, can you scan it, etc. And if it's not reconciled, then you don't know if you have them all or what's missing. If you're manually coding and you're handwriting codes on a chart or on a piece of paper, that's a lot worse, and again, less secure for HIPAA. If the coder does the entry of the codes, now you're paying a coder to do data entry, and that's a mismatch of costs. And once again, if you have no edits, then it goes in, you may get denied, and that's a problem. So, getting these things done quickly and effectively makes you more productive and puts the emphasis on getting the work done in the best and most effective way. So in charge entry, if you bill for office practices, patients that are seen by appointment, if your software is in the practice, then the customer can put in the charges. And customers will sometimes somewhat ridiculously say, oh, well, now we're doing your work. Well, that assumes that you have no work to do. This is a partnership. This is a shared effort. You're going to put in the charges, and we're going to take it from there. If not, the charges can be received electronically or maybe by scan. I think we should be long past the days of super bills, but even if you have them, sometimes you can set up OCR, optical character recognition, or auto entry if the practice is using an EMR. Most of the EMRs have a charge selection process or a charge assignment process that can be downloaded. If you have to, scan it from OCR. Onshore costs for charge entry versus offshore costs. So sometimes offshore is a cost savings or a productivity enhancement. If you're up against a staffing recruiting challenge, sometimes that's the trigger that I've seen billing companies say, we can't find enough people to handle the new volume from our new business. So now we have to, it's not a matter of politics, it's a matter of practicality. We've used up the local labor force. Charge entry, all charges should be posted within 24 hours. There's a term that's been around forever in the billing industry called lag days. And that's the lag between the date of service and the date of billing. And it should be less than 3 business days. Now, my view is in the 21st century, the lag day should be 1 or 1.x, it's under 2, but it shouldn't be 3 plus. And the worst of charge entry is, again, you're getting everything by mail or courier or FedEx, carrier pigeon. You're getting super bills. You're posting them by hand without any controls. If I get a super bill and there are 4 things marked, 4 charges marked, and I key 3 of them, they just lost money. And so did I. So did my company. How do I know how many are on the pages with a hash total at the end to say, we have 27 pages, and there are 49 charges, and when I get to the end of the batch and I've only entered 46 of them, I missed 3. So it's easier to do this electronically. If you get it days and days later, and I usually, when I'm in person at conferences, I'll say something about the client who sends you a wheelbarrow full or a box full of charges on the 28th of the month, insisting you get everything in by the end of the month, and everybody kind of laughs and everybody is shaking their head like, yeah, I have one of those customers. They're running your business for you. You don't have lag days over 3. Claim submission. So claim submission should be daily at the very minimum, or hourly. It makes me a little crazy when I run into software vendors whose software only gathers and submits charges once a week, and they're still out there. That makes no business sense whatsoever in the 21st century. You should be billing with a clearinghouse, although they have fees, or direct, which is free. And there's a toss-up there, because if it's direct, now someone in your company has to manually manage that process, and you're paying labor to do that, and they can make mistakes or be out sick or something like that. So there is a balance to be found between direct submission and saving the clearinghouse fee, or using a clearinghouse and not having the labor of managing that process. But one or the other, and that should be a financial decision, a process decision that you evaluate periodically. It should be auto-reconciled for the receipt verification, acknowledgement of the claim, and the claim should be submitted within 4 hours of whatever ready means in your software. Instead of billing on paper, I mean, there are always going to be some paper claims, but fewer and fewer. Sending electronic less than daily makes no sense whatever. And this will increase your productivity. It will shorten the days in AR. It will increase the customer's cash flow and yours, although that's a one-time thing. You shouldn't be manually managing the claim submission, except for what I said before about the direct versus clearinghouse. Not reconciling what you sent with what was received is a recipe for trouble. And anything submitted more than 12 hours from ready is late. So if you're still buying cases and cases of paper 1500 forms, that's a red flag that you're not using electronic claims as much as you ought to. And of course, remit should be the same. And here we go. So ERAs and EFTs should be 90% of your claim work. Everything should be going out electronically, and at least 90% or more of everything coming back should be electronically. If it's anything other than ERA and EFT, it should go to a lockbox. Yes, banks charge money for that. It adds more security. It makes it more difficult for your employees to embezzle money, and they do. And it provides your clients with immediate access to their cash because it went to the bank and not to you. All your payments should be auto-posted if they're electronic. You shouldn't be getting an ERA and having anybody touch a keyboard. Yes, there are reconciliation issues, but if you work on managing that and enhancing the reconciliation, they can eventually be minimized as well. You should have less than 5% of the exceptions for ERA and EFTs, and all of that should be posted within 2 hours, including the reconciliation. So the idea is you create expectations of the workflow, expectations of productivity, expectations of turnaround times, and then manage to that, because if you don't, I can take a 1 hour job and make it last all day because I don't feel like working any day, or maybe today. But if you set the pace, there are ways to get the work done, and that saves you time and money. And rather than eliminating jobs, it frees up your staff to do other things that are more productive. The worst way, of course, would be to download and print remittances. Once again, you've created a new HIPAA problem because you printed it out. And you say, well, I didn't print it. I just saved the PDF and I typed it, I posted from a screen. Well, yeah, that's a little better, but why not make it electronic in the first place? So manually posting payments is an issue. I'll talk in a minute or two about patient payments. Not having controls or reconciliations. I think as a matter of practice, billing companies should be reconciling the daily posting to the practice's bank deposit. Now, the practice could do that for itself, but I think as a matter of internal control, it's a good idea for companies to do that as well. If you have to manually enter payments, how many seconds per line item? How quickly should the work get done? If it's not about how many dollars are being posted. It doesn't take any more time to post $1 or less time than to post $1,000. That's 3 keystrokes. So productivity should be on line items, and you should have reference points for expectations. It shouldn't make any difference who the payer is either. Getting it done eventually is just not the way to go. Direct payments. And there are really, I guess, 2 kinds of those. The paper checks that come in the mail, and on some occasions, for billing companies, depending on your physical location, some of you get patients who actually walk in the door and pay in person, but you get paper checks. That should be less than 5%. I think it should be approaching 0 in the 21st century. Patient payments should be going to the lockbox. They shouldn't be coming to your P.O. box or your office address, because, again, another opportunity for employees to steal the checks, to embezzle the money, and if possible, use OCR. If you ever go to Target or Walmart and you hand them a paper check, they run it through a scanner and they hand the check back to you because they've processed the image. You should be able to do the same thing. There's no reason that won't work. You can find local banks that will provide that as a service. Reconciliation should be done real time, and any live check should be posted and processed the day they're received. There should never be live checks sitting around. The worst way to do this is to post payments from the live check. If you separate the physical check from the posting, the person posting has to enter the payment and they can't steal the check. So the idea is if you're scanning the checks, they're getting deposited, and I'm posting from an image, that's different. That's a way to secure it an additional way. Not having any controls or reconciliation is a recipe for theft. Having live checks in the office, it should be treated like they're radioactive. They should be in the office and gone within the same business day. If you get a lot of them, they should be in a safe, in a locked file cabinet, and a limited number of people who have keys to those checks. And the worst would be to deposit once a week or every few days as opposed to depositing every day. Again, back to the best practice where you're using scanned images to make the deposits in real time. So with patient payments, if patient payments in the more broad sense, there should be a patient portal. And if your customer doesn't have one, There are a number of vendors that will provide that as a private label service. Instamet is one, Zermet is one, there's a number of others. Those products will feed into your billing system and auto post the payments. So the patient pays through the portal and the payment posts itself, and your labor just went to zero. If you have a lockbox with scanning, the bank can often provide the deposit and provide you with a data entry file, an 835 file that will allow the payments to post themselves. If you have a voice response phone system, some of those products also offer auto posting. Any credit card processing that you do should be PCI compliant. PCI is the payment card industry. They are far advanced in terms of data security and compliance with the most advanced requirements for information protection for the consumer as well as the business. Any patient payment should be posted the same day, period. And some of the systems now will also, through the vendors, allow patients to receive their statement by text message, and they can pay their bill by text message. Those would be auto posted. And for those of you who know about Venmo, Venmo is a sister company of the, just went blank on the parent company, but Venmo is, again, an online payment. So I can pay my bills using Venmo with any vendor who is equipped to receive it that way. If you have paper checks, they shouldn't be posted manually. And you have to have controls. Not having a patient portal in the 21st century makes no business sense whatsoever. It's make work for your office staff, for your company employees. They're going to object because they missed the day of handling checks and doing things the hard way. We should be automated. And anybody who's receiving paper credit cards and manually entering those, the practice writes them down or gets them in the mail, and they bundle them up and send. I mean, there's my credit card, your credit card information floating around in the world to be seen by anybody who has a cell phone with a camera function. If you have card entry credit card machines, that's the hard way to do it. It's the old-fashioned. And if your company, ABC Billing, has the merchant account and you're processing for your customers, that's illegal. So if you have a call center, the best is you're auto-routing your calls. All the calls are voice recorded. You know, all of our calls are recorded for quality and training purposes. We hear it and we don't even hear it anymore. Your call management system, if you have one, should provide reporting on who took the calls, how long each call was, who spent the most time on the phone with one call each day, so forth, so you can begin to build data on employee productivity. Minutes per call, inbound and outbound, are how you measure this. An inbound call should be over in 8 minutes. The patient initiated the call. It's a surprise every time you say hello. So you have to, it takes a little more time to get them to tell the tale and answer. If you're making outbound calls, those should be 6 minutes. You've initiated the call. You know the agenda. You want to get to the end of the conversation and move on. Whoever, you have handsets. Why aren't you using headsets? It's random. Whose turn is it to answer the phone today or this morning? Does it match to the specialty or the client or some other logic? If there's no metrics, and if your system is not a system and everybody is keeping records of their calls with a piece of paper or a spreadsheet, that's better than doing nothing. But your software, your call system should be able to do that. so that you know how many calls came in and what the length of those calls was, so that you can keep track of how your employees are doing with their productivity. So insurance follow-up. There's actually a spreadsheet that you got as a handout, and I'm going to talk about that on a later slide, but this is a way to illustrate your processes. The best would be, if you're unfamiliar with the HIPAA transaction code set numbers, the 270 and 271. 270 is the status query, and 271 is the response. That should be at least 60% of your insurance follow-up. If the insurer accepts an electronic claim, they're required to support the 270, 271 transactions and allow you to query the claim status. You can set up your system to do that automatically without any employee even having to do it. And that should be the first step. Maybe that 60% should be 90%, but it should be a high percentage. In some cases, it's a direct website access. I would accept that while I'm pressuring them to support the 270, 271, because that's a requirement. That's a HIPAA regulation. At the very minimum, a batch query where you send in a list and you get the query the next morning. Your software should support automated scheduled follow-up based on events. The claim was billed and the claim is now 24 days old. And based on history, we should have an answer back in 21 days, and we've given them a 3-day grace period. And on day 24, they're automatically pulled up for pursuit. And maybe the software can do the 270 on day 24. If you're on the phone, the notes should be logged and mostly automated using numbers or some quick entry method. Less than 20% of your insurance follow-up should be by telephone. You have to re-engineer this to be more productive. Your employees who do it like being on the phone. It's a social activity. They're not going to be the ones to suggest to you that we should find a way to eliminate that more manual, historic, we did it back in the 1970s this way. And there should be results tracking. You should know that based on whatever methods you use for doing insurance follow-up, what those results produced in money. It's not just going through the motions. Are those motions producing cash results for your customers? Because if you're getting paid, I'll just pick a number and say 6% of collections, what is 6% of a small amount of money generated by insurance follow-up? Because it has to be cost effective for you and the customer, not just the customer. And the worst way to do this, of course, is one by one. Back up here. That's, you're on eternal hold. You have paper notes, handwritten notes on a printout. You have hand-entered call notes typed into the software to your billing system. There's no way to have any productivity metrics, no way to measure results. And that's just not the way that things should be done in 2019. Maybe in, 1999, maybe in 1989, but not in 2019. So first of all, denials, the main mantra here is prevention. You want to prevent denials, and that requires data and analysis and tracking. The denials that you get should be auto-posted. They should be posted automatically using the denial code, and then based on that, your software may be able to route it to the denial person or persons in your company responsible for that. Many companies have denial specialists, which allows you to have metrics and do cost analysis to say which ones are for either denials we can resolve and get paid, and which ones, and the opposite, which ones aren't worth the effort because, we get money out of them 1% of the time, and the rest of the time we're just spinning our wheels. You can develop priority and decision flow charts once you have denial data, which requires that you do tracking. Do you have denial reports pulled out of your system? Are you sorting those reports by reason, by payer, by provider, by diagnosis code, by CPT code? What's the most knowledge you can gain on the character of denials so that you can then begin to attack them and back to prevention? The worst way to do this, and I still see companies doing it, they're posting denials, they're posting payments by hand, they're posting the denial, and the person doing the posting stops what they're doing and, quote, works the denial, whatever that means. So now you've disrupted the efficient, cost-effective posting of payments, and you've given the employee a break to do something and fill up some time. And I'm not trying to denigrate that there are diligent employees who do the right thing, but you have not maintained the efficiency of your billing factory. There's no reporting or tracking. Everybody who posts payments is doing them. Some people are better at them and some are not. And the idea that, well, we work them all, there are some appeals that are worth filing and there are some appeals that are not worth filing. So again, it's doing the analysis of the work, figuring out the most efficient and cost-effective way to do the individual tasks, and minimizing the manual work that used to exist 25 or 30 years ago. So patient AR and bad debt. The first cut would be, do we do, as an industry, do billing companies do patient AR follow-up? Do we dial for dollars? We're not collection agencies, and are we in the business of dealing with consumers? Now, you can say, well, if the balance is more than $500, yes, we do that. Do you do it on balances for $15 or $30? No, because if your fee is 6% and you get paid, 6% of a $30 payment isn't even $2, and you spent $5 to $10 per call, even if it produces no money. And if you call every $30 balance, does every $30 balance pay you? No. If you're lucky, it'll be 10 or 20% at the most. So the math just doesn't work. If you work them based on $1 and age threshold, it narrows the work to something that may be productive. Do you do cost and results tracking? That is, do the people you pay to do that work produce cash results for the customers? And does the fee that your company gets paid pay for them to be doing the work? Most of the time, the answer is no, which is why most companies don't do consumer calls. If you're making calls, it should be a 6-minute call. You should be developing monthly summaries of the results that those employees produced, number of calls, the idea of, well, touches, what's a touch? If I called the house and I left a message because it was 3 p.m. and everybody was at work, do we count that or do we not count it unless I talk to a person? It was their teenage child who answered the phone. I left a message. It's the same as an answering machine. There are software products that have automated reminders that will feed into a phone system that will make automatic reminder calls. Some have Tickler or AR management tools. Some of the payment vendors and some of the software vendors have the capability of setting up monthly payment plans. So if you bill for surgeons or anesthesiologists or practices with high dollar balances, sometimes you can set up monthly payments. The idea that you have as a company motto, we work every account, doesn't make any business sense. We're not employees of the practice. The practice can spend all its own money, but we have a business to run. But if you have no schedule, no controls, you're not tracking results, it's whatever, whenever, you shouldn't be doing this at all. I've seen paper AR lists of patient balances, people writing notes on their paper calendar, and manually typed and collection notes in the software. Certainly, documentation is a good thing. But the question is, should we, other than the inbound calls, should we be making these entries, and should we be in the business of the proactive patient calls? Credit balances. Again, prevention. Why are you having credit balances? There are lots of legitimate reasons. It's not that there can ever be a zero number. But if you're having large numbers of the same thing, maybe there's a way to prevent them. You may know that the OIG requires that credit balances be resolved within 60 days, not just Medicare, not just Medicaid, all of them. And it's known as a reverse false claim. It's, instead of saying, I set a claim for a service I didn't provide, that's a false claim. Instead, I got paid more than I should have. I got overpaid, and I kept the overpayment. That's a reverse false claim. 60 days to close them out. Report them weekly or at least bi-weekly. Every system should be able to produce a credit balance report. All of the documentation that you prepare, the so-called package of documents, should be electronic. Nothing says that you have to print everything out and staple it together and send the customer a 14-pound box with all the documentation. It should all be electronic. It should be in PDF form, and it should be something that you could put on a flash drive or send it to them by email or use your VPN. There should be a refund account. Either the practice does it, you do it. We don't have time to get into those, but the point is that all the work is divisible down to how many minutes per balance for the people responsible for handling credit balances. It is a more tedious process, but it shouldn't be an hour each, and it shouldn't be a half an hour each. It should be something smaller, 15 minutes each, 10 minutes each, on average. Some take more. The point is you should have an expectation and track to it. Doing it all by hand, I mean, this is the worst way. We do it when we have time, when we get to it. You're using paper forms and photocopies. You ship the package to the customer. There's no metrics. Credit balance management is an essential service, but there are ways to make it more cost and time efficient, and that's the thing to pay attention to. Incoming calls from clients. This is another thing. CRM is customer relationship management. This is a whole different discussion, but if you have either that or there are ways to use Outlook for the same function, you're basically creating I'll call it a ledger. It's a communication ledger of all the contacts from your customers and what they've asked for and what you've called them about. And there should be a record of every call, who talked to them, what the topic was, what promises were requested or made, and what answers were provided. Keep track of the time and frequency. I'll bet if I said, just take a piece of paper that's nearby. Excuse me for just a moment. Sorry, it's allergy season here in Pennsylvania. So keep track of it. I'll bet you that certain clients are the high dependency customers, the ones that are the most troublesome, the most time consuming, and maybe you need to have the data to get back to the customer to say, you know, we've spent 6 hours per week on the phone with you for the last month. Maybe we need to set up a different format and set up a time budget or just say, we're going to have a call every Tuesday and Thursday, and we're going to budget an hour so that we can do this in a more effective way. Because if you instead, it's on the fly, it's whatever, whenever. Everybody in the office talks to the customer as opposed to narrowing that down to one or two people. If you have no record of calls, no reporting, and no accountability, I got to tell you, this is one of the things that makes work for me as an expert witness, because the customer management process hasn't been formalized in a way that provides records of things that happen and maybe didn't happen. And filing. This is kind of the last of the best and the worst. There should be no filing. There should be no filing. You should have a document management system that's built into your software or bolted on. You can buy them, or you should use a vendor. So Aquarius, eBridge, there's a number of them. Everything should be electronically archived into organized folders so that you don't have any paper to file. Because if you have filing cabinets and shelves and boxes and desk drawers, stacks of stuff, and everybody has some, number one, it's a huge HIPAA risk. Number two, it's a cost, and it's a very inefficient way. You know, in the old days, we had bankers' boxes that were either stored in the office or stored in rented space. Those should all be in the Smithsonian. And if that's not part of the way your company does business today, make that a priority. Everything should be scanned. Everything should be stored. We have a 7-year responsibility to retain records for compliance purposes, even after they're gone. And the last thing you need is a bunch of expense to store boxes of stuff when the customer's not even paying you revenue anymore. So these are, these are important things to think about, because it improves your staff productivity. The best of the document management systems will allow a patient call to come in, and if you need to look at the image of the EOB or in the image of the check or some other document, it's indexed to the account, and I can look at your account record and at the document simultaneously, and I don't have to go someplace to pull them out or look at them or say, I'm going to have to go get them and call you back. So we could go on and on and on and on, and I almost did. But do you need a chief productivity officer? I know that some of the companies on today's call are small, that you have 3, 4, 5, 10 employees. It may be that the owner of the company has to be this new job. The point is that if you don't re-examine what you do and how you do it, and look for ways to be more productive, to be more efficient, to be more cost effective, you'll keep doing it the old way. And another decade will go by when you're not taking advantage of the best and most appropriate methods to get the work done. Back to the beginning, we do what we have to do to get the job done. And when Dave Giachello and I do this, and we look at billing companies, we've kind of agreed that every billing company we've ever seen is overstaffed by 20%. Now that just means that you are 20% inefficient, that there are ways that you could be more productive, that 20% of your headcount is doing things they shouldn't need to do or could be done more efficiently. And you could thereby bring in new customers without hiring more employees. So it's, I'll call it unused capacity. That's the euphemism. Simply put, is it easier to increase your revenue from your current client base or reduce your operating costs? Well, how do you increase your revenue from your current customers? Well, collecting more of their money. I assume everybody's doing kind of the best they can with that. And that's a losing proposition, because the insurers are paying less, not more. it's a lot easier to reduce your operating cost. And typically that is more productivity from the employees you have with the same staffing, more productivity, and add new customers without adding new employees. Because you can find lots of ways to be more efficient inside of your company, be more productive. Basically, the whole idea of a chief productivity officer should be self-funding. You know, I'll say this is something I do for building companies, but this is something that you really should be able to do for yourselves if you kind of step back and decide, I'm going to look at my company like I've never seen it before and do this for myself. So you have a spreadsheet that you received as a handout, and I wanted to put this on the screen to give you an illustration. This is for AR follow-up. And if you see on the left side, the first two columns, you have AR follow-up and then claims per hour and hours per day for one FTE. The green numbers and the hourly rate, which is also in green, are the only three things you have to put in. Do you have a 6.5-hour workday? Do you have a 5-hour workday? Do you have nobody has an 8-hour workday. Nobody works 8 hours. You pay for 8, but you don't get 8 hours of work. And if you have 5 reps, you have to put that number, that's in green, and the total number of reps, you have to put that in. And everything else populates itself. Because the idea is that if you're doing 20 claims an hour for AR follow-up, maybe that should be 40. Maybe it should be 60. But if you put that number in, it tells you how many claims per day. And if you lose 25% of your productivity, your cost goes from $130 a day to $162.50. If you lose half of your productivity, that 130 becomes 195. That's your cost because you put in the hourly rate and you put in the claims per hour. So if you use this as a template for all of the other functions in your shop, demographics, charge entry, coding, payment posting, etc. This is a way for you to see, and the numbers won't lie to you. You can lie to the numbers. But I put the graphics here at the bottom. That's a stopwatch on the left. You actually, you use your smartphone now, but use a stopwatch to track the work and do it over enough time and use your fastest and your slowest employees to figure out why there's a variation. I've got an abacus in there because you have to count things. And I've got a time clock in there because you need your own time records to see who's doing what. Some of you have very sophisticated timekeeping systems that will allow you to keep track of doing different tasks. In the morning, I post payments. In the afternoon, I'm on the phone, or whatever way you divide the work. Some of you charge it to each customer. So having your time records is important. The one in between the abacus and the stopwatch, those are your computer system, your billing system reports. And using those reports to begin to tease out the information you need to understand the work and the processes and the results and so forth. And then over there on the right in the laptop, those are your spreadsheets and statistics that you can build to start to keep track of things, to see pretty much where you begin. That's your baseline. And then keep track of things that you pay attention to see whether they're improving or declining and how those changes look over time. So the whole intent of this is to, get a lot done, to understand the work itself, to measure it, to know what your productivity is, whatever that may be today, and then look at and examine all of those activities to figure out better, faster, cheaper, more, different ways to improve the productivity of your company, even with the same headcount. And you can perhaps develop ways to bring on another client or 2 or 3 more and not hire any more people because you become more efficient in your day-to-day operation.
This is really great, Bob. Thank you so much.
We have another 6 minutes for some questions.
Okay. Can you hear me? First of all, I want to say thanks, Bob. That was really informative. I love the spreadsheet. It's great. Just to add, Venmo is the company that's owned by PayPal. And
thank you.
okay.
I just couldn't come up with the PayPal, even though I have an account.
No, it's good. I heard you say that things that are done continuously, if you're doing the same task continuously, then you get better results, right? Because you're doing the same action over and over versus flipping to something else.
Right.
And Tim says, great content. As FYI, the most RCM companies are not collection agencies. They may be treated like a collection agency in certain states and be required to be licensed as a collection agency, which I know is the case in Arizona. So thank you, Tim. It's true. We have to be really careful. And Maryland, right. So we got to be very careful with that. How do you recommend, like, just while, questions are coming in here, you mentioned something about having a system to measure patient calls. Is there a particular, what's your recommendation for tracking them?
Well, most billing companies have a phone, in quotes, say system. It's not sort of the old-fashioned, the local phone company provided you with a main number and 48 extensions. Now, because of software, you can have a commercial phone call management system. The phone company connects to that software, and the software then manages the calls and records the calls, tracks the calls, keeps track of all of that. There are lots of products. It's something I haven't needed to look at for a few years, but I know, when I had a billing company, we had a very expensive one, and I could run reports on the individual activity of each extension, calls in, calls out, numbers that were called, numbers that called in if you have caller ID. And the whole idea is you're running a business, and the use of the phone indicates an employee using minutes, using the time you pay for, and you should be able to manage that. And now I think a lot of these products are available as a cloud-based system. So I think just looking into call management software will give you an idea of what's out there. But it's a function of your business, and you need to have a way to manage it.
Right. Another thing to add is that email and text messaging systems for patient balances are also an easy way to get patients to pay faster and to eliminate some of those patient calls. And I'm also curious to know.
I'm glad that came up, Hani, because I've been an evangelist for what's called electronic presentment. That's sending the patient statement as an email. Most of the statement vendors now support that. All you need is the patient's email address. They get an email. The statement's not in the email. In the email is a link. They click the link. They have to log in, and they can view their statement. And while they're there, they can pay their bill. And now you have no postage, and the patient makes the payment, and the payment posts itself. So much more efficient.
For sure. Okay, Tanya says that OCRs for EOB recognition, is there one you can recommend? I would say I would recommend eBridge would be my recommendation on that, but I'm sure there's others.
I agree.
Paper EOBs all have different formats, and it may be higher error rate than when scanned automatically. So Yeah, Bob, do you have any others other than eBridge to look at? Any other OCR products out there? I know
Well,
ShareFile. I'm not sure if they have.
yeah, I don't think ShareFile does. I know Aquarius and there's a third company I can't think of right now. But again, if you do a little internet shopping, I think you'll find a variety of software, healthcare related document management software. Some of the software vendors have either their own as a captive, or they have a relationship with one or two or three vendors that they can recommend, and that's more efficient because it's now integrated with the software you use. So I would do that first.
Okay, cool. Okay, well, thank you, everybody. Bob, thank you so much, and thanks, everyone, for attending and contributing. Mark your calendars, May 9th, Dave Giachello. Bob mentioned his name a few times today. Dave will be talking to us about really great presentation. I heard it, some of it in New Orleans. He did something. I asked him to do something similar. Where are you at? Are you a freshman, junior, senior in your billing company? Where do you stack up amongst your competitors, and what could you do to reach the next level? Thank you so much, everybody, and I'll see you next month. Bye, everybody.
Bye-bye.